So what about the hospitals in all of this? Well, the Netcare CEO Richard Friedland says hospitals in Gauteng currently under tremendous strain. This as the infections are continuing to rise as the third wave bites the province. Friedland goes on to say that vaccine supply constraints are not making the situation any better.
Our biggest concern is the cold weather. We tend to be huddled together indoors, poorly ventilated spaces with very little social distancing. So here in the Gauteng, we are now, in terms of active cases, approximately 50% of where we were in the second wave. What we're seeing with this third wave, it tends to be the gradient of that slope has happened a bit slower, and we think it might last a bit longer than we saw in the second wave, remembering that the second wave was halted here in the Gauteng when government delayed children going back to school in early January and also put in quite significant restrictions. So we are seeing a significant rise in hospital admissions across all private and government facilities in the province. Fortunately, I think that we have very good oxygen supply, and on a positive note, more than 80% of healthcare workers have been fully vaccinated. So I think the hospitals are a safer place from a healthcare worker perspective, but nonetheless, our hospitals are under pressure. And remembering that in the second wave, we came off the December year-end and holiday season where hospitals weren't full. A lot of hospitals are already full with patients who don't have COVID. So it's a very tricky and a very fine balancing act that we are having to manage very carefully at the moment.